Good evening. My name is Antoinette Carter, and today I would like to speak to you about a topic that is becoming an epidemic concern to parents worldwide and to teachers alike. My topic is about childhood depression, its causes and symptoms, and how can we help as teachers. What causes depression in children? As in adults, depression in children can be caused by any combination of factors that relates to physical health, life events, family history, environment, genetic vulnerability, and biochemical disturbances. Depression is not a passing mood, nor is it a condition that will go away without proper treatment. Can depression in children be prevented? Children with a family history of depression are at greater risk of experiencing depression themselves. Children who have parents that suffer from depression tends to develop their first episode of depression earlier than children whose parents do not. Children from chaotic or conflicted families or children and teens who abuse substances like alcohol and drugs are also at greater risk of depression. What are causes and risk factors for depression in children? Depression in children does not have one specific cause. Rather, people with this illness tends to have a number of biological, psychological, and environmental contributors to its development. Psychological contributors to depression includes low self-esteem, negative body image, being excessively self-critical, and often feeling helpless when dealing with negative events. Children who suffer from conduct disorder, attention deficit hyperactivity disorder, or ADHD, clinical anxiety, or who have cognitive or learning problem, as well as trouble engaging in social activities, also have more risk of developing depression. Depression may also be a reaction to life stresses like trauma, which includes verbal abuse, physical or sexual abuse, the death of a loved one, school problems, being bullied, or suffering from peer pressure. Signs of childhood depression. It is not uncommon for children to be diagnosed with both depression and an anxiety disorder, or depression and general anxiety. About half of people diagnosed with depression are also diagnosed with an anxiety disorder. Children with depression may display these symptoms: depressed or irritable mood, difficulty sleeping or concentrating, changes in grade, getting into trouble at school or refusing to go to school, change in eating habits, feeling angry or irritable, mood swings, feeling worthless or restless, frequent sadness or crying, withdrawing from friends and activity, loss of energy, low self-esteem, or thoughts of death or suicide. Statistic reports show that children who are depressed have difficulty concentrating in class and completing their work. They may have difficulty relating to classmates and to teaching staff. Their learning suffers, and there may be long-term effects on their school achievements unless they receive professional support promptly. How to help as teachers. School staff can notice signs of depression by observing changes in children's behavior and mood. They can address any school-based triggers that may be impacting on children's mental health and well-being. Peer group difficulties, especially bullying, are common triggers for children's depression. What it looks like in school. Complaints of feeling sick, school absences, lack of participation, sleepiness, isolation from peers, problems with social skills, defiance, poor working completion, forgetting to complete assignments, difficulty concentrating, refusing to complete work, missing deadlines, working at a slower pace than the usual. We can also help by encouraging them to get involved. Children with depression may lack their usual level of energy and complain of being bored. We can provide praises and encouragement for their effort, and even try to engage them in physical activities and pleasant events. We can even step it up a bit further. We can provide extra learning support by asking other school staff if they are able to help with children to catch up on their schoolwork once their depression has subsided. This is important as falling behind in schoolwork can be a source of stress that may aggravate depressions once more. Connecting with parents and caregivers. It is important to share information obtained through school's observation and to find out whether the child's mood is similar at home. When mood and behavior changes are evident in more than one setting, it usually indicates that the problems are more severe. In closing, not only adults become depressed, children and teenagers also may have depression as well. The good news is that depression is a treatable illness. Early diagnosis and treatments are essential for depressed children. Depression is a real illness that requires professional help. Comprehensive treatment often includes both individual and family therapy. For example, cognitive behavioral therapy, or CBT, and interpersonal psychotherapy, IPT, are forms of individual therapy shown to be effective in treating depression. Treatments may also include the use of antidepressant medication. For help, parents should ask their physician to refer them to a qualified mental health professional, which can diagnose and treat depression in children and teenagers as well. For further information on childhood depression and where to go for help, I have provided a list of health professionals and their contact info. Thank you and have a great evening. Once again, my name is Antoinette Carter, and thank you.